Good morning, Charlotte here with Home Care Sales by PowerShot Training with your tip of the week. I wanted to talk about a lot of things that happen when you're following the top 20 sales training that I see with organizations that I help manage around the country. One of the most important things is something that we are all missing is the monthly recap meeting. You guys have finally gotten those accounts to start to give you referrals. And yet, sometimes we just stop right there. And we keep visiting them weekly. We keep trying to give them something unique and making our visits valuable. However, if we're not getting in front of the actual people who identify patients to refer, we're missing a great opportunity. So I really encourage all of you this month to go around and look at your top accounts that are referring to you and get them on a monthly recap meeting. That monthly recap meeting could be just, if it's with a large physician's practice, just 3 to 5 minutes long with the physician. You might have to bring a small little meal just so that you can actually get the physicians to join you. But at that time, review the patients that they have referred. Know that at least the diagnosis is maybe, and if they're still on services. But then, have two weapons ready to go to help them identify additional patients that maybe they haven't even thought of referring to you. For example, if a patient came in and they made a medication change and they wish that they knew what those patients' vital signs were, they would be perfect if they're homebound to be referred for home health services so that we can go in there and teach the patient not only how to take their medications, but side effects of the medications, what to do if they miss a dose, what signs and symptoms they should be reporting back to the staff, and offer it as a solution to the physician's office where, if the patients are being educated on their medications, they'll know exactly if there's lab work that's required so that they don't bother you with renewals. Think about, you could also at that time bring any additional documentation that the doctor needs to sign. This way you're not wasting or bogging down their fax machine, sometimes with duplicate, triplicate orders because they didn't sign something so you just resend it. And that really troubles the physician's practices. It just bombards them and floods them with documentations, and a lot of it is duplicates. So I challenge you to get the monthly recap scheduled. You will see that your accounts, it's truly the way to get them to grow from a C or a B account up to that A bucket, because you're actually educating the physicians who are able to identify the patients that they should be referring. So that's my tip of the week, and the challenge that I bring to you is to go out there and get your monthly recap scheduled. I hope you have an amazing day. Thank you.